Mike. Well, you've gone all the traditional routes, but nothing seems to work for your depression. Well, have you tried TMS, depression therapy? Dr. Stephen Harvey is here from TMS St. Louis to talk about it this morning. We're glad you're here on Great Day St. Louis.
Oh, thanks. Glad to be here.
Well, let's start with just an overview of what TMS therapy is.
Yeah, TMS stands for Transcranial Magnetic Stimulation. It's a relatively new treatment for depression, generally for the more severe types of depression. And it involves using focused magnetic pulses on the brain to treat some of the root causes of depression. And it's used for people who for whom medications and other treatments don't work.
So the antidepressants hadn't worked for them. They tried a number of traditional routes, and they're really just trying desperately to find something to help them out.
Exactly. Yeah. Most of the patients we get have had severe depression for years and years. A lot of them are not able to work. A lot of them are more or less miserable every day, regardless of what happens to them that day, good or bad. And most of them have had good psychiatric treatment. Have seen psychiatrists and counselors, and have tried several different antidepressant medications. But one thing we know is if someone's tried, let's say, 5 or 6 different antidepressant medications, if those haven't worked, then the chances of antidepressant number 7 working is vanishingly small. You know, if medications don't work, then the next one probably won't work either. And that's where TMS comes in, because TMS is entirely different than medications. And a lot of these people who might have thought there was no hope or thought they would never get better, do get better with TMS.
Yeah, so as we take a look, a picture of your machine here, this is a non-invasive procedure. This isn't something that requires hospitalization. This is something they come into your office. So walk us through what a treatment session is like.
Sure. So in TMS, we start by going through a longer procedure to find the targeted area of the brain. And once we find that spot or that location, then we tighten up the helmet and turn on the machine, and it delivers a pulsatile magnetic field. Now, the magnetic field is very strong. It's of a strength similar to that of an MRI scanner. And it's not a static magnet. It's not like a magnet that picks up a car in a junkyard or something. It's not like that. It's a pulsed magnetic field.
Okay.
So when the machine is delivering the magnetic pulses, it goes brrrr for a couple of seconds, and then there's a pause, and then it goes brrrr. And so we give those magnetic pulses for about 20 minutes.
Okay.
And then the treatment's over. And the course of treatments occurs over several weeks for about 30+ treatments.
What kind of results have your patients had? What have they come back to tell you?
Very, very impressive results.
Yeah.
Really kind of surpassed my own expectations.
Really? Love to hear that.
Yeah, like a lot of other psychiatrists, I'm used to giving medicines and talking to people and so forth. So it was a little hard to wrap my head around something new like this. But a lot of our patients have had just wonderful results, which is good to see. People who have been severely depressed for 10 years, 20 years.
And truly having a new outlook on life as a result of this, and able to handle life's obstacles much better than they would have in the past.
Yes, yeah. People could go from being miserable every day to feeling fine. You know, and the improvement with TMS seems to persist for a long time. We've been doing this for a couple of years, and occasionally we'll contact people who we treated a couple of years ago to see how they're doing. And they're like, no, I'm fine.
Really?
You know, we wonder if maybe they want to come back for more treatment. They're like, nah, I'm fine.
Really? Yeah. And the question a lot of people have is this covered by insurance?
And the answer is a conditional yes. It's covered by a lot of insurance companies.
Okay.
I think the bigger insurance companies have caught on to TMS, because I think TMS, even though it's expensive, it saves money in the long run because you avoid hospitalization and ECT and things like that. So the big insurers mostly are covering. Some other insurers are not. Insurance coverage is spreading, so more insurance companies are going to cover. TMS is covered by Medicare in about half the country. including Illinois, but not including Missouri yet. But
do
it
your
will.
homework on that. Dr. Harvey, very eye-opening. Thank you. We appreciate your time this morning, walking us through all of that.
Thank you.
TMS St. Louis, located in Creve Coeur. For more information, here's a number. Give them a call, 1-844-WANT-TMS. That's 1-844-926-8867. Or you can always visit them online at tmsstlouis.com. Mike?
Thank you.